So today we'll be talking about aspirin overdose or poisoning. Now the question is, how are we going to diagnose a patient of aspirin overdose? This patient will come to you with hyperventilation, tinnitus, an altered mental status, renal toxicity, and on ABGs this patient will have respiratory alkalosis. This respiratory alkalosis will eventually progress to metabolic acidosis. The metabolic acidosis in these patients is from lactate because aspirin interferes with oxidative phosphorylation and causes an anaerobic glucose metabolism resulting in lactate production. And this lactate eventually then causes metabolic acidosis in these patients. These patients also will have an increased anion gap. Since this patient has respiratory alkalosis that eventually progresses to metabolic acidosis, so on ABGs you will see that both the carbon dioxide and bicarbonate levels will be decreased. Aspirin also interferes with the prothrombin production and raises the prothrombin time. So in these patients the prothrombin time will also be raised, and that will also help you in diagnosis of these patients. Now how are we going to treat these patients? We give these patients sodium bicarbonate, that is alkalinize their urine so that they can rapidly excrete aspirin from their body, and hemodialysis.